Jack Kevorkian, a name synonymous with death and controversy. Known to many as Dr. Death, Kevorkian's actions and beliefs have left an indelible mark on the medical and ethical landscape of our society. In the 1990s, this Michigan pathologist became a lightning rod for one of the most contentious issues of our time: euthanasia, the right to die. Kevorkian's advocacy for physician-assisted suicide brought the topic into the public eye, forcing a nation to confront its views on life, death, and personal autonomy. Kevorkian, dubbed Dr. Death by the media, ignited a firestorm of debate by publicly assisting in the suicides of terminally ill patients. His actions were not just medical procedures. They were statements challenging the medical community and legal system to reconsider their stance on end-of-life care. His methods, often theatrical and defiant, challenged societal norms and legal boundaries. Kevorkian's use of homemade devices and his willingness to be filmed during the procedures added a layer of spectacle that both horrified and fascinated the public. Kevorkian's actions sparked outrage and condemnation from some, while others hailed him as a compassionate liberator. The debate was not just about the legality of his actions, but about the moral and ethical implications of allowing individuals to choose the timing and manner of their own deaths. This is the story of a man who dared to challenge the status quo, igniting a national conversation about death with dignity. Kevorkian's legacy is a complex one, filled with both admiration and controversy, but it undeniably pushed the boundaries of how we think about life, death, and the rights of the terminally ill. At the heart of Jack Kevorkian's controversial crusade was a deeply held belief in the right to die with dignity. He was often referred to as Dr. Death, a moniker that belied the compassion and empathy that drove his mission. Kevorkian's philosophy was rooted in the conviction that individuals should have the ultimate say over their own lives, especially when faced with terminal illness and unbearable pain. Kevorkian viewed death not as a medical failure, but as an inherent part of life. He believed that the medical community's role should extend beyond merely prolonging life at all costs. Instead, he advocated for a more holistic approach that included the option of assisted death for those suffering without hope of recovery. He argued that individuals facing unbearable suffering should have the autonomy to choose the timing and manner of their death. This perspective was revolutionary and challenged the traditional medical ethics that prioritized life preservation above all else. Kevorkian's stance was that true compassion involved respecting a patient's wishes, even if that meant aiding in their death. His experiences as a pathologist, witnessing the limitations of medicine, shaped his philosophy. He saw firsthand the agony of patients for whom modern medicine could offer no relief. These experiences reinforced his belief that in certain cases, death could be a merciful release rather than a defeat. Kevorkian's views resonated with those yearning for greater control over their own mortality. Many people, especially those with terminal illnesses, found solace in his message. They saw in Kevorkian a champion for their right to end their suffering on their own terms. His message of compassion and choice sparked a national conversation about the right to die with dignity. This debate brought to light the ethical, legal, and emotional complexities surrounding euthanasia and physician-assisted suicide. Kevorkian's legacy continues to influence discussions on end-of-life care, challenging society to reconsider what it means to die with dignity. In 1990, Jack Kevorkian introduced the world to the Mercitron, a homemade contraption linked to his mission. The Mercitron, consisting of intravenous lines and canisters, provided a quick and painless death. Public reaction was mixed. Some saw it as compassionate, others as a macabre instrument of death. Regardless, the Mercitron became a powerful symbol of the right to die movement. This invention thrust Kevorkian further into the public eye, turning him into a cultural icon. The Mercitron became a lightning rod for a nation grappling with its own mortality. Behind the headlines were the deeply personal and often heart-wrenching stories of Jack Kevorkian's patients, individuals who sought his assistance in ending their lives. These were not just names in the news, they were real people with families, dreams, and fears, facing unimaginable pain and suffering. Janet Adkins, diagnosed with early-onset Alzheimer's, feared the slow and inevitable decline of her cognitive abilities. She was a vibrant woman who loved life, but the prospect of losing her memory and independence was too much to bear. Her decision to end her life with Kevorkian's assistance ignited a fierce and polarizing debate about the right to die. It brought to the forefront questions about autonomy, dignity, and the ethical boundaries of medical intervention. Thomas Uke, suffering from the debilitating effects of Lou Gehrig's disease, reached out to Kevorkian in his final stages. His condition had deteriorated to the point where he could no longer move or speak, and he was in constant pain. His death, captured on video, was a chilling testament to Kevorkian's defiance of both law and traditional medical ethics. It was a stark and controversial act that would lead to Kevorkian's eventual imprisonment. These stories highlight the complex and often conflicting motivations behind the choices made by Kevorkian's patients. They were driven by a desire to escape unbearable suffering, to maintain control over their own lives, and to die with dignity. These were desperate acts, born out of a profound sense of hopelessness and a desire to end their suffering on their own terms. The emotional toll on their families was immense, but for many, it was seen as a final act of love and compassion. Section 5. The Legal Battlefield, Kevorkian's Fight for Right to Die. Jack Kevorkian's crusade for the right to die was intertwined with a series of legal battles. His acts of assisted suicide repeatedly landed him in the crosshairs of the law. Prosecutors pursued Kevorkian, determined to hold him accountable for his actions. Kevorkian used his trials as a platform to advocate for the right to die. His trials forced juries to grapple with fundamental questions about life, medical intervention, and autonomy. Kevorkian's legal battles brought the issue to the forefront of public consciousness. Section 6. Inside the Walls, Kevorkian's prison sentence. In 1999, Jack Kevorkian's defiance culminated in a manslaughter conviction for the death of Thomas Uke. Sentenced to 10 to 25 years in prison, Kevorkian entered the Michigan correctional system. Despite prison life, Kevorkian remained unrepentant, continuing to advocate for the right to die. His time behind bars solidified his status as a martyr for the cause. Kevorkian's imprisonment amplified his message, turning him into a symbol of resistance. His story took on a new dimension, transforming him into an icon of the right to die movement. Section 7. Unwavering Conviction, Kevorkian's Release and Continued Advocacy. After serving 8 years, Jack Kevorkian was granted parole in 2007. His release marked the end of his time behind bars, but not his crusade. Kevorkian, though frail, remained committed to his cause, continuing to advocate for the right to die. His message remained unchanged. Individuals should have the right to choose the timing and manner of their death. Kevorkian's post-prison years were a testament to his unwavering belief in the right to die. Section 8. A Legacy of Controversy, Kevorkian's Impact on the Right to Die movement. Jack Kevorkian's death in 2011 marked the end of a life linked to assisted suicide. His legacy is complex, a mix of admiration and revulsion. Critics argue he crossed the line from compassionate physician to dangerous vigilante. Supporters view him as a pioneer who brought attention to dying with dignity. Kevorkian's legacy is a testament to the power of one person to ignite a national debate. Section 9. The debate continues euthanasia in the 21st century. More than a decade after Kevorkian's death, the debate over assisted suicide continues. The legal landscape has shifted, with more states and countries legalizing physician-assisted death. This reflects a growing recognition of patient autonomy and the right to make end-of-life choices. However, opposition remains strong, rooted in religious beliefs and ethical concerns. Kevorkian's story serves as a reminder of the complexities involved and the need for continued dialogue. Section 10. A question for our time. Where do we go from here? The story of Jack Kevorkian leads us to a fundamental question. How do we as a society want to die? We must move beyond fear and engage in thoughtful dialogue about end-of-life choices. Kevorkian's legacy serves as a catalyst for this conversation, reminding us that death is an inevitable part of life. The question now is how we can create a system of end-of-life care that honors both the sanctity of life and the individual's right to choose a dignified death.